Hello, I'm Mercedes Stephenson, and this is the West Block, politics, perspectives, and players.
This is an unprecedented situation and calls for unprecedented response.
Our focus is on what we need to do now to get through this so that our economy can come roaring back.
Some of the folks who've just rebuilt their homes over the past 4 years now see those very same homes underwater at a time that was already incredibly challenging with the economic adversity plus the pandemic.
Tech giants have announced plans to add software that would enable contact tracing in their devices.
Canadians put a very high value on their privacy, on their data security, and we need to make sure we respect that even in a time of emergency measures.
Governments around the world, including here in Canada, are looking at applications installed on cell phones to help officials conduct something called contact tracing, a process where public health officials are able to figure out who somebody who's infected with COVID-19 might have had contact with. And while these apps may help control the spread of coronavirus once economies reopen, what are some of the privacy implications of the government tracing your movements? Here is Canadian Prime Minister Justin Trudeau.
As we move forward on taking decisions, we're going to keep in mind that Canadians put a very high value on their privacy, on their data security, and we need to make sure we respect that even in a time of emergency measures and significant difficulty and crisis.
Joining me now to discuss this is Privacy Commissioner Daniel Therrien. Thank you so much for joining us, sir.
Thank you. Good to be on your show.
Can you tell me what some of your concerns are about these COVID-19 apps that provide contact tracing information to governments?
There's no question that these applications raise privacy issues, but the first thing I would like to say is that we think that privacy and the protection of public health can be achieved at the same time. So it's not a question of either having public health protection or privacy. It is possible to have both at the same time. But there's no question that privacy is engaged with these applications. How do you protect both privacy and public health? Essentially, the technology needs to be designed properly. If not designed properly, there can be huge privacy concerns. But if the technology is designed properly with an eye to important privacy principles that I can describe in a second, then it is possible to have both.
So walk us through what are some of those privacy safeguards that would make an app safe to use for public health purposes without sacrificing your personal privacy?
Yes, so there are a number of them. I won't go through all of them, but just the most important. The first one is to ensure that the application collects and uses information only for public health purposes and not, for instance, for commercial purposes or general state surveillance purposes. If it's limited to the protection of public health, then that is appropriate. Another safeguard is that information should be de-identified and aggregate to the extent possible. In other words, the sensitive health data or the location data should remain on the phone, and only de-identified and aggregate information should be sent to the government, to public health authorities, so that they can monitor trends at a general level, but not know where each individual is. If consent is relied upon, and the Prime Minister has suggested this week that the government is looking at a consensual, voluntary way to adopt these applications. So if that is the case, consent needs to be meaningful. And we all know of long-winded privacy policies that do not lead to meaningful consent. So it's important that consent be meaningful. The last criteria or safeguard I'll mention is that these applications need to have a limited time period. We can understand that for important public health protection purposes, that what would normally not be acceptable may be acceptable during this crisis. But it is important that as soon as the pandemic is controlled, that could take weeks, months, certainly several months, but when that occurs, the collection of information should stop, and the information that was collected for public health purposes should be destroyed.
Has the government contacted you or been in touch with you at all to look for your advice on how to do this in a way that is sensitive to privacy while achieving what they're hoping to in terms of knowing when infected people have been in contact with others?
Essentially, we have sent our framework to government departments. We know that government departments have it and are considering the framework. They have not sought our views on specific applications at this point. We have offered our services. They know where we live, so they have our framework. We have offered our services. That's where things stand.
You talked about informed consent. Do you think that the government should have the power to make this mandatory for those who don't sign up for an app?
That's a difficult question. So again, I remind your viewers that the Prime Minister indicated earlier a few days ago that the government is looking at a voluntary, that is consensual way of doing things. If the applications in question became mandatory, then it would be particularly important that other principles would apply, such as limiting the purpose to public health protection, the time limit. There would also be, I think, enhanced emphasis on how effective is the application in question. In order to meet privacy safeguards, the measure needs to be necessary and proportionate, that is science-based. And we have heard a few days ago Dr. Tam, if I'm not mistaken, and other officials say that they're not yet convinced as to the effectiveness of the applications in question. If it became mandatory, it would be extremely important that the application be found to be effective.
A lot of interesting questions for Canadians and for the government ahead. Thank you so much for joining us.
You're welcome.
That's all the time we have for today. Thanks for joining us. For the West Block, I'm Mercedes Stephenson.